Welcome back to the second half of Our City. I'm pleased to be joined in the second half by Miss Angelica Rodriguez and Miss Karen David, two nurses with our public health department. Angelica, Karen, welcome to the show.
Thank you.
So first of all, Angelica, you were on the show, so I'm going to start with Karen. Karen, tell us a little about yourself, your degree, where is it from, school? I heard you were born in Elizabeth, then left, and now you're back.
Right now I'm living in Elizabeth. I went to William Patterson University with their nursing program. I have my bachelor's in nursing, and I'm currently getting my graduate degree at Rutgers.
Good. Angelica, you've been on the show before, so you're a veteran.
Well,
tell us about yourself.
Once, but I went to Felician College in Lodi, and then actually now I'm going back for my graduate as well.
Are you in Rutgers?
Rutgers.
And are you taking classes together?
We are.
We try our best to.
It'll be a good study group, right?
Yeah. Yes. Mm-hmm.
So Felician College, by the way, is that still all women or no?
No.
It's co-ed now, right? But it was all women for...
I'm not sure. When I went, it was co-ed.
It was co-ed when you went?
I think it's actually a university now.
Okay. So breast cancer.
Yes.
Serious topic, and October, I believe, is Breast Cancer Awareness Month, right? So we're going to start with you, Karen. You're going to talk a little bit about what is breast cancer.
Well, breast cancer actually begins when abnormal cells grow out of control in your breast tissue.
And easily diagnosed?
With screening, yes.
Right. And so Angelica, awareness is a topic that you're going to spend some time talking about.
Yeah, awareness is very important. You know, breast cancer is the most common cancer among women after skin cancer, but it's the leading cause of death. It's the second leading cause of death in women after lung cancer. So it's very important to make people aware, because the earlier that you get screened, the better outcome that you have. So, you know, some statistics on it, just to give everybody a big picture. For this year, about 246,000 people, or women, will be diagnosed with breast cancer. And
men can get breast cancer.
Yes, right? Actually, I have that as my second statistic. But 40,000 women will die of breast cancer this year. And women are not the only ones that get breast cancer. Men can also get breast cancer. And this year will be 2,600 men that will be diagnosed, and about 400 that will die from breast cancer.
So, Karen, we talked before the early detection. You talked about screening. What are the screening and what is early detection? Is it just self-exams, or are there actually medical visits?
Well, actually, a screening, it's actually done with a mammogram, which is an x-ray of the breast. And if they find something in the mammogram, you have to be sent for further testing. And this is done with a biopsy. That actually confirms a diagnosis of breast cancer. And then treatment follows after that, which includes chemotherapy, radiation, and hormone therapy.
So early detection is extremely important for a cure.
Yes, very important.
So since you're both in the nursing field, are there classes, or do people teach women about self-exams, and do women do it, or they kind of ignore it and wait for the mammograms?
Well, I mean, it's taught when you go to your gynecologist. It can be taught by either your gynecologist or your primary doctor. Actually, the American Cancer Society doesn't really recommend the breast self-exam. They say that you can have it.
That's why I think you should share that.
Yeah, they say that you can do it, but they don't recommend it. Usually, clinical breast exams, which is the doctor doing it, and self-breast exams, they can be done, but it's not recommended. They really want people to go get screened, which is having a mammogram. And
Angelica, one of the reasons it's not recommended is because you can miss.
You can miss it. You can miss it, or you can find something that's not there. So you're sending somebody for invasive tests that they don't need at this time. So that's why they don't recommend it.
So one of the things we talked about before the show were risk factors on breast cancer. What are the risk factors?
Well, being a woman, that's one of the risk factors.
Because in numbers, there's more.
Because the numbers are high, right? Yeah. Older age. So as you get older, the older you get, the more risk you have of having breast cancer. Personal history and also family history is a very important one. If you have a family history, so first degree, so mother, sister, you have a higher chance of having breast cancer. Women who have menopause at an early age, they have a chance of getting breast cancer. And also women who menstruated early too. No, women who menstruated early, so 12, and women who have menopause late, they have a chance of getting breast cancer.
And when you say women who menopause late, what
after 50.
After 50. So if you have menopause later in life,
you have a chance, more at risk
You're
of
higher risk.
Higher risk.
As opposed to a woman who may go through menopause in their 40s, is what you're saying?
Yes. And also menstruation before age 12. You're at
So
risk.
if menstruation occurs before age 12, you're at high risk. Are there statistics in that area? Is that why it happens? That's how we know this is a
Yeah,
fact?
these are when they put out these facts, they're evidence based. So they've had studies on it, and they've done research on these things.
So in we always hear smoking is associated with lung cancer. Is smoking or cigar smoking or other areas of that, is that
Like
associated with
healthy-
breast cancer? Yeah,
like
healthy
healthy
eating,
eating.
or healthy or smoking. Can that
is-
affect breast cancer?
Having a healthy lifestyle will put you less at risk. So obesity and smoking and things like that can put you at risk of having cancer or getting cancer.
Signs and symptoms. You gonna do that, Karen?
Sure. Well, it's important for women to know what their breasts look and feel like normally so that if there's a change, they are aware of it. The most common symptom for new onset breast cancer would be a lump or a mass. Normally the hard, irregular borders are more associated with breast cancer, but also soft and painless nodules are also associated.
So is there ever any changing of color of the breasts or anything like that? Would that be a sign?
Redness,
or redness?
scaliness of the breast, also swelling of parts of the breast, nipple discharge other than breast milk, nipple retraction, and nipple pain.
And do most women know that? I mean, are they taught this, or they kind of like, hey, it hurts, I got to go see a doctor? And then
'cause
sometimes it might be
could
too
even
late, right?
It could be painless. So I think
It can be painless.
it can be painless. So I think one of the most important things is, as Karen said, knowing what your breasts normally look like. So just taking a look, examining, just looking at yourself and knowing that when you do see something that's not normally there, or it didn't look like that last month or even 2 months ago, then you know, this is different. Let me go get it checked.
Get it
and that's
checked.
important, going to the doctor and actually getting it checked.
So who should get screened? Is there an age? Is there a demographic that should get screened? Who should get screened?
Yes. The American Cancer Society, they recommend, so ages 40 to 44, they say you should have the discussion with your doctor. You should talk about it and see if you should get screened. Ages 45 to 54, they should get screened annually. And then after that, they recommend every 2 years to get screened.
So if nothing, but I guess if there's nothing there.
If there's nothing there.
Yeah, every 2 years.
Every 2 years.
And is there statistics on how many women actually do follow these guidelines, or
I don't have
you don't
that.
know that,
No,
right?
I don't know that. No.
Is it ever recommended for women less than 40 to be screened if there's a family history?
If there's a family history, yeah. So if you have these first degree relatives, so like I said, like mother, sister, aunt, then you should get screened beforehand. But that's why they should definitely talk to their doctor, and the doctor, their medical provider, can let them know when they should be screened.
So what about women, actresses and movie stars who have made decisions to have mastectomies and then go very, very public about it? And in some cases, they said they really didn't need it at that time. But
I mean, it's their gene. That
Yeah,
they-
it's an option for people who do want to go ahead and do that if they do have the strong family history.
tell us about that gene that, a guy like me doesn't.
Right.
What is that gene
it's like
that people talk
a gene
about?
mutation that's inherited from your family line that puts you more at risk for the mutated cells to grow abnormally in the body.
Yeah, so
in the
it's
breast tissue.
BRCA1, so they call it BRCA1, BRCA2. So this is a gene this is what these women are getting tested for, and they're making that decision to go ahead and get the mastectomy. They don't necessarily have the cancer, but they have the gene that may put them at risk for getting that. So that's something that, again, this is a decision that you make with your doctor, because you may not get cancer, but you may.
You may.
So this is why they.
So it's
make
a lot
that.
of discussion.
It's a
Right.
lot.
So what agencies do we partner with, nurse?
We right now we're partnering with the American Cancer Society, and we are also partnering with the Gateway Family YMCA, the Elizabeth branch. So we're partnering with them. For the American Cancer Society, the walk that we're having, we're actually, all of the proceeds are going straight to the American
Tell
Cancer
us about
Society.
that walk.
Okay. So the walk is on October 1st. It's on Saturday. The registration begins at 12 and the walk begins at 1. So registration is basically they're coming in, they're signing a waiver, and then they can make a donation at that time if they like. And
Are you walking?
Yes,
Are
absolutely.
you walking? Okay.
We will be there.
Why is the walk so important? I mean, awareness is tantamount to success, correct?
Yes, absolutely. The walk is important because you're bringing a whole community together to bring awareness to a cause or to something that they may know about it, but they may not be, take it serious. Like you said, it's a serious disease.
And if they want to participate, where do they call?
They can call us at 908-820-4250.
Ladies, nurses, I want to thank you for taking the time to join us on the show and all of your work, not only in breast cancer, but in public health issues, working for the City of Elizabeth and dealing with public health matters of concern. Thank you.
Thank you.
Thank
Thank
you.
you. I want to thank Ms. Karen David, Ms. Angelica Rodriguez for discussing Breast Cancer Awareness Month, and also on the first part of the show, Ms. Linda Weaver and Ms. Marianne Brenner of the Elizabeth Gardens Club. Please enjoy this show, and we'll see you next week on another edition of Our City.
We're creating tomorrow's jobs today. Kane University.